All right, Jess. This is patient assessment trauma.
Okay.
You have 10 minutes to complete this. Do you have any questions?
No questions.
All right. You're dispatched to a logging yard for a possible amputation.
Okay. BSI is my scene safe.
Yes.
All right. So I'm going to determine. So the mechanism of injury would be a logging accident, potential amputation. Is this my only patient?
Yes.
Okay. All right. I'm going to request additional EMS and consider C-spine for the patient.
Okay. You walk up, bystander, he's laying on the ground, bystanders are holding towels to his leg. You notice that the towels are blood soaked, and there's a large pool of blood under him, and he looks pale.
Okay. I'm going to check my responsiveness of the patient.
He's alert.
Alert. All right. So I'm going to go ahead and say my general impression of this patient is poor, clearly a big pool of blood. Patient is alert at this time, but obvious trauma. I'm going to treat any life threats. Is there bleeding?
Yeah, he has heavy bleeding from an amputation to his left leg.
All right, I'm going to go ahead and put a tourniquet on, high and tight on the left leg.
Okay.
Does that control the bleeding?
Yes.
All right, I'm going to note the time on the tourniquet and then continue on. Is there any other obvious bleeding, anything I need to know about for life threats?
No.
Okay, I'm going to move into my ABCs. Airway. How's my patient's airway?
It's patent.
Patent, okay. Breathing, how's my patient's breathing rate, rhythm, quality of the breaths?
They are 18 and bilateral chest rise and fall. He's moving in air.
Okay. Any obvious injuries to the chest? Any flail segments? Anything I need to treat right now?
No.
Okay. All right. I'm going to move on to circulation. What's my patient's skin color, temperature, condition?
It is pale, cool diaphragm.
Okay. I'm going to get a pulse on this patient and see what's the quality of rate, rhythm, quality of the pulse.
It's 110 and regular.
Okay. High flow oxygen for this patient and treating for shock, so covering the patient with a blanket and keep the patient warm. Then I'm going to move in, try to get my partner to get a sample history and OPQRST and vital signs. And as well as when there's available, I get 2 large bore IVs on this patient.
Okay.
And then I'm going to move into my secondary assessment. So starting with the head and palpate the head, looking for any decap BTLS.
You're clear.
Okay, looking in the eyes, looking for raccoon eyes and pearl, if they're pearl.
They are pearl.
Okay, looking for battle signs and any halo or any fluid coming out of the ears.
Clear.
Okay, looking in the mouth, is there any secretions, vomit?
Still patent.
Still patent. Patient is still alert with us, right?
Yep.
Okay.
He's GCS of 15.
Okay. All right. So I'm going to go down and check the cervical spine, feeling for step-offs, anything like that.
No step-offs.
All right. Looking for tracheal deviation or JVD, anything noticed there?
Clear.
Okay. Palpate the chest. Feel for any flail segments, anything that needs to be concerned with.
Nope. Clear.
Okay. Moving down on the abdomen, I'm going to palpate all 4 quadrants. Any pain, any rigidity, or distension?
Nope. You're clear.
Okay. Pelvis, going to press in and down. Any pain or any instability?
Stable.
Stable. Okay. I'm going to check for priapism. Any priapism?
No.
Okay. I'm going to check the lower extremities. So you said the left leg is a lower amputation. Is the bleeding still controlled?
Yes, with your tourniquet.
Okay. There won't be CMS below this tourniquet. On the right side, how's the leg? Any other injuries there?
He has a minor laceration.
Okay. I'll direct one of my partners to treat that.
Okay. It's treated. Bleeding's controlled.
Okay. Checking the upper extremities. Any decap BTLS?
No.
Okay. And I'm going to check CMS in all extremities.
We're good.
All
Except for
good?
your tourniquet.
except for where the tourniquet is. Okay, as we're gonna log roll the patient, I would have said back then to consider C-spine. So we're gonna take C-spine precautions, roll the patient on the back, and palpate on the back for any step-offs, any injuries, any bleeding, anything noticeable.
Nope.
Okay, I'm gonna go back down on the backboard, fully immobilize the patient, and we'll go ahead and get going. I will say this is a rapid transport patient. We're going to get him, it's a high priority. We're going to get him to the hospital as quickly as possible. Treatment. So at this time, I'm going to treat for shock. I'm going to, with high flow oxygen, fluid boluses, so 20 milligrams per kilogram. And I'm going to give pain meds, so fentanyl. That would be 1 microgram per kilogram.
Okay.
And at this time, just gonna reassess all my interventions, looking for any bleeding, anything like that. Reassess my vitals. What was my vitals, by the way?
Oh, blood pressure is 100/20, pulse is 120, respirations are 18.
Okay.
He's GCS 15.
GCS 15. Okay. I'm going to reassess those every 5 minutes, and we're going to get into the hospital as quickly as possible when I'm done with this patient.
Cool.